You know, when things hurt, you don't want to move them. Everybody can relate to that. I am a physician, so I knew that I wasn't going to get better.
I've known Pete Goldman since I moved to Allentown back in 1983. He would refer many of his patients to me, and I performed hip and knee replacements back then for him. So I've known Pete for a long time.
I knew almost immediately that I was inflicted with degenerative arthritis of my left hip. I suffered, if you will, with the pain, a lot of Advil.
Pete kind of knew when he came that he had two bad hips. In his case, he had significant restriction of motion, and he actually refused to have any conservative care because he understood that that was going to be a Band-Aid and not a fix, and therefore we decided to do total hips on both sides.
I had no apprehension whatsoever at all because I'd had decades of experience referring patients for joint replacements, hip replacements, especially to Dr. Scarpino.
With the anterior approach, the biggest advantage is that we have a special table that we use called the HANA table, and this allows me to visualize the components as we put them in the body so that we get them in optimum position every time. There are no dislocation precautions, and I encourage them to return to full activities as quickly as possible.
After 6 weeks, predictably, I had no pain after the surgery on both sides.
Pete was a physician, and he was familiar with the rehab, and really recovery was of the poster boy variety.
Now, I'm not a very athletic individual, and I don't have a very high energy lifestyle, but now that my hips are done and the results are perfect, I can do everything now that I could and did do at age 20.